Chula Radio Plus presents Chula Innovations Unlocked.
Based on Interpol, there are three primary identifiers used to confirm the identification of deceased victims: fingerprints, DNA, and dental records. But believe it or not, Thailand has less than 30 forensic dentists living and working in this country. This is why today, Chula Innovations Unlocked visits Chulalongkorn University's Faculty of Dentistry to talk to one of Thailand's prominent forensic odontologists about the need to have more forensic dentists in the system. Dr. Pisha, thank you so much for your time and welcome to Chula Innovations Unlocked.
Thank you and welcome to the Museum of Human Body.
Right, yes, it is quite astonishing. And for those of you who want to visit this place, feel free to visit this museum at the Faculty of Dentistry on Henry Dunant Street.
Yes.
Right. Okay, my first question would be, of all the fields of dentistry, how did you find your way to become a forensic dentist?
It began first in after I graduated from the Faculty of Dentistry, and I started working here as a lecturer in the Department of Radiology.
Okay.
And on that year, at the end of the year, tsunami happened.
That was 2004.
Yes, 2004. And so I volunteered myself to the south of Thailand to help with the body identification.
Right. And how did that work out?
So I helped them taking the X-rays of the teeth, and after that I felt that this is the field that we should try to develop in Thailand, because at that time there was only one forensic odontologist in Thailand.
Right. How many are there right now as we speak?
24.
24.
Yes.
Is that enough?
I don't think it's enough.
You don't think it's enough? How many should we have in Thailand?
Actually, there is no certain number, but still, I think if something happens, I think we need to have the dentist who understand this kind of knowledge and be able to work on the cases. Actually, dental identification is one of the primary identification method of the Interpol. So it means that we can use the teeth to be able to identify the persons.
Okay.
And the teeth is really actually the main evidence that can be used.
Okay, so apart from other evidence like tattoos, piercings, and other physical structures, the teeth can also identify.
Actually, according to the Interpol guideline, we use there are three primary identification methods: the fingerprint, and the DNA comparison, and the dental comparison. So these are the three scientific methods that we currently use for human identification.
Right. To become a forensic dentist, must you complete dentistry school, or can you come from other fields of science and then
we have to be a dentist.
You have to be a dentist.
Yeah, because we need a basic knowledge of dentistry to be able to understand all the restoration on the teeth. Yeah.
Okay, fine. Then what subjects do you have to study on top of dentistry?
When I study for forensic odontology, I had to study the forensic medicine, like to go to the autopsy and to learn how the forensic pathologist works, and also about the DNA, the genetics, and also the anthropology, the bones. Yeah.
Right. I don't intend to be rude, but I'm sure that the audience at home would very much want to know, do forensic dentists make as much money as other dentists?
Of course not.
Of course not.
Unfortunately.
Sad but true.
Yeah, sad but true. At the moment, we don't earn anything from doing all the cases. Yeah.
Right. So that means every time you go out for a case, including one of the celebrities who drowned recently, you don't get any money.
No, nothing. Yeah.
Why do you do it?
I think I do it for the public. And for the relatives or for the people.
Right.
Yeah.
In other countries, do forensic dentists get support from, or how do they get support?
I guess they get support from the government, maybe a little bit, but usually the forensic odontologists, they have their own practice. They can be orthodontists or they can be general practitioners.
Right.
And there are cases, then they go and work as a forensic odontologist.
Right.
It's more like, it's almost like a hobby, but not a hobby, you know?
It's very serious when it comes to the crime scene, right?
Yes.
Can you share with us some of the interesting cases that you've been through?
Yeah. Usually when the forensic pathologists or forensic doctors, as we call them, call me, they would call me if they cannot identify the body. So it means the body must be decomposed, very decomposed, that you cannot recognize the person, or is skeletonized, or just some partial remains. So, and there was one time I was called, I have a friend at Chulalongkorn hospital who worked as a forensic doctor, and he called me and he asked me, there is a body that was cut to pieces and being frozen in the freezer. And so he called me to help identify the body by doing the examination of the teeth.
Right.
Yeah.
And the finding was?
So he was a foreigner, and we did all the dental examination very thoroughly, and we did all the x-rays, the full mouth x-rays. So we took an x-ray of all teeth, and then we waited for the dental records from the dentist. Yeah.
From abroad, where he came from.
Abroad.
Right. So not only that, I mean, if you can identify what the individual's teeth looks like, but then you will have to compare with the original records. How do we manage that in terms of information and images?
So we try to make, we call it post-mortem, so it's after death. So we try to make the post-mortem dental records as good as possible, and we contact the police, and the police will contact maybe the embassy to be able to get the information from abroad. Yeah.
Right. What can the teeth of a dead person tell us?
Actually, the teeth from the dead person they are like the teeth of the living persons.
Right.
They have restorations, the crowns or the fillings. Sometimes they have the orthodontic instruments. And their teeth can be quite unique, and how the alignment of all the teeth and how the shape looks like, things like that.
So just from looking at the teeth, can you be able to tell the gender?
The gender can be quite difficult. But the age, we can approximate the age of the person from the teeth.
Race or nationality?
Can be sometimes. There are some features that are specific for some ethnicities.
Right.
Yeah.
You mentioned in an interview that a dead person's teeth can talk. What do you mean by that?
So even if they are dead, I mean the teeth can still give us information that so the information that can bring them back to their family. That's how it is.
Okay, apart from identifying a dead person, can we determine the cause of death by just looking at the teeth?
I think that will be quite difficult. So we have to work together with the forensic doctors and maybe with the forensic scientists. Yeah, so we have to do the multidisciplinary approach for that.
Right. How many universities in Thailand teach forensic odontology?
Nowadays, I think there's only one place in Chiang Mai, at Chiang Mai University. There is one PhD in forensic osteology and odontology. It's like a combine between the bone and teeth. Yeah.
Oh, okay. So there's only one place?
Yes, only one place.
But I hear that you do have plans to be approaching some people to be opening your own course here in Chula.
Yes, I'm planning because the other day I just had a meeting in my faculty about opening a course or trying to open a course for as a postgraduate study for the forensic odontology.
Right.
Yeah.
I mean, in terms of practice, I mean, what would be the drive for an individual to become a forensic dentist? The pay is pretty low. You have to work with dead bodies, pretty much quite often decayed, and you get called at times where sometimes at night.
Yeah. For me, if you ask me, it's my personal preference or personal passion. Yeah, can be because I went to the tsunami. Maybe that's one of the big inspiration that I felt that we need to do it.
Right.
But and I mean, I don't want any disaster to happen, but I'm sure that one day it will. and people will need to understand that we need this kind of knowledge to be able to help in case something happens. Yeah.
Right. How do other countries treat forensic dentists?
I think some countries don't have forensic odontologists, but some countries they have forensic odontologists. Like for example, in Southeast Asia, I think in Indonesia they have several forensic odontologists because their country they have a lot of disasters. It's how it works. And also in Japan, they also have forensic odontologists. And like when I studied in Belgium, there were also a few forensic odontologists over there because there was some disaster that happened before. Yeah.
Were there any like classic cases, I mean, not only in Thailand, but maybe around the world, that forensic dentists like you cracked the case?
Actually, we forensic dentists can work on identification and the age estimation and also the bite mark analysis. And in the US, many years ago, before the DNA comparison was available, there was one serial killer, Ted Bundy, and the police caught them and used the bite mark analysis to be able to convict that Ted Bundy just bit the person.
One of the victims.
Yeah, one of the victims.
Oh, and that was and that was the factor that closed the case.
Yes.
Ah, I see.
It's very, very famous. It's very, very famous case for the bite mark analysis.
Okay. Now, jumping back to your day job. Apart from being a forensic dentist, your day job is being a radiologist.
Yes.
Right. What exactly does a radiologist do?
So actually I teach in the university, I teach dental students radiology, and we take x-rays for the patients to use for diagnosis, and we also do the interpretation of the x-rays, the radiographs, to give the diagnosis and the treatment plan that they will need.
Right.
Yeah. Usually I teach in a lecture. I give a lecture to dental students, and I will be also in the clinic to supervise the dental students to take to practice taking the x-rays on the patients, on real patients. And then I also do the interpretation of the cases, like both two-dimensional and three-dimensional images.
Right.
Yeah, of the facial region and teeth. Yes.
I see. Now, that's one part of your life.
Yes.
The other part is being a forensic dentist, right? What's the most difficult part?
I think because we don't know when it's going to happen. It can happen on the day that I was very busy, or you can be very busy on that day and you didn't plan to go to do the examination, but then if someone called me, then I have to leave other things behind and then go right away to the autopsy room.
Right. Okay, so you don't have to go to the crime scene or at the site, but
at the autopsy room.
Autopsy room.
After they already bring the body.
I see.
But this is just an individual case, like there's only one person dead.
Right.
But if there's a disaster, like a bomb or anything like that, then there must be another kind of management. We call it disaster management.
Okay.
Then we have to make plans to do and finish all the work. Yeah.
Right. From taking the images from the teeth, from examination to collecting the data, what sort of technology or perhaps artificial intelligence would you need to make your job easier?
At the moment, we depend a lot on the person. Yes, but we need to take x-rays. We use digital x-rays at the moment. So we take the portable x-ray machine to the autopsy room, and then we take the x-rays. We use the sensor, digital sensor, to be able to capture the x-ray images, and then we store it in the computer on the laptop, and then we can use it to help with the comparison. But I think the AI can possibly help with the comparison software if available, because nowadays I think they are not really available yet in wider market.
Right.
Yeah, to help to see if that person can be the person, can be this person or not.
Right.
Yeah. For example, if we have 10 dental records and we want to know if these 10 dental records can be this person, so we have to find the similarities between the records
Right.
and see the possibilities. Yeah,
So
I think that AI can help.
So you're saying that in many cases, it's not like 100% accurate.
No.
But it's a percentage of
Yeah,
variations?
because most of the time we depends a lot on the restorations on the teeth. And if that person have only 1 or 2 restorations, it can be quite difficult to say exactly that, yeah, this is the person, this is
Right.
it. Yeah, you have to try to find many features as much as possible.
I see. Now, if the body is buried underground or kept in a fridge, like
Yeah.
you mentioned, that's one thing. But what happens if there are cases like Inferno?
Yeah, we had those kind of cases. The teeth could be very fragile. Yeah, because with the heat and everything, it's quite difficult to take the X-rays of those charred body, burnt body, and yeah, it can be quite challenging.
Right. And if a body was killed in a car accident where perhaps the facial bone structure was corrupted, would that affect your
Yeah, of course,
field?
it will be quite difficult. But then you may need to try to use other evidence like the DNA if still available. Maybe if you cannot get it from the flesh, you can get it from the bone.
Right.
Yeah.
Now, with all this data, it's important that you have to compare
Yes.
with the data you had before.
Yes.
Now, with the Personal Data Protection Act, PDPA, is that making your job a bit difficult?
Not really. Not
To
necessarily.
retrieve information, personal information from a person presumed dead?
For example, if there's one unknown body and I do all the examination already finished and I have the postmortem dental data, then we have to work with the police. The police will be the one who contact the hospital or the dental clinics. According to the Thai law, they will have to get as much information as possible to be
Right.
able to help with the case.
It doesn't slow down the process.
No.
Though. No, it doesn't at all. I've always heard that you have to visit the doctor twice a year,
Yes.
brush your teeth every day, floss if possible. Would that really affect the quality and strength of your teeth? And once you're somehow buried in the ground somewhere and somebody finds you, will that like make your teeth more durable?
I think not directly. Because if you go and visit your dentist every 6 months, and sometimes the dentist will take x-rays, and then they will have the records of your teeth as an x-ray and radiographs. And then I think that one is very important evidence. Once, if you are buried in the ground, not you, but
Anyone. Yeah, pretty
it's
much.
buried in the ground, and then we take the skull out, and then we can see the teeth. Even all the soft tissue is already decomposed, the teeth remains.
Right.
So you can still take x-rays of the skull and compare it with the records from the clinic.
Right. Should we kind of set this as a national agenda where at the age of 7, everybody gets an ID card? Perhaps at the age of a certain age, everybody gets a dental x-ray as a record.
I think you have to think that x-ray is radiation. So if you want to take x-ray on the patients, you need to have a reason, an objective that you want to do the follow-up of something, or you want to see if there is decay. But if you don't have any reason, you shouldn't take the x-rays because the patient will get the extra radiation that is not necessary.
Oh, okay.
So we use it as low as possibly achievable, reasonably achievable.
Right. Is there anything you'd like to tell to the authorities or people in charge at all levels regarding how much more support you need in order for us, Thailand, to have more forensic dentists?
I think first I have to try to make a course happen, but for the authorities, I think it would be very useful. For example, if someone like a person goes to a clinic or a hospital and they are registered in the system, so one day if that person went missing, then you can see that, okay, this person went to that clinic or went to that hospital, and then the police can contact the clinic or the hospital to trace back to see if they have any dental evidence that they can use.
Right.
Because now I think this is the thing that we are lacking. So if I ask the relatives or the friends, they don't know, even the families, they don't know that person, where the person go to have the dental check.
Well, Dr. Pisha, I'm sure that you will be another individual who will be making positive changes to the dental fields and perhaps influence and inspire more people to become forensic dentists. Thank you so much for your time, Doctor.
Thank you so much.
ขอบคุณครับอาจารย์
สวัสดีค่ะ
Chula Innovations Unlocked is produced and presented by Superjohn Klinsawan. This program is brought to you by Chulalongkorn University.